What is gynecologic cancer? Diagram of the female reproductive system showing the fallopian tubes, ovaries, uterus, cervix, vagina, and vulva. This diagram shows different parts of a woman's reproductive system. Copyright 2021 Therese Winslow LLC. U.S. government has certain rights. Used with permission. Contact artist at www.theresewinslow.com for licensing. Gynecologic cancer is any cancer that starts in a woman's reproductive organs. Cancer is always named for the part of the body where it starts. Gynecologic cancers begin in different places within a woman's pelvis, which is the area below the stomach and in between the hip bones. Types of gynecologic cancer. Cervical cancer begins in the cervix, which is the lower, narrow end of the uterus. The uterus is also called the womb. Ovarian cancer begins in the ovaries, which are located on each side of the uterus. Some ovarian cancers can also begin in the fallopian tubes or peritoneum. Uterine cancer begins in the uterus, the pear-shaped organ in a woman's pelvis where the baby grows when she is pregnant. Vaginal cancer begins in the vagina, which is the hollow, tube-like channel between the bottom of the uterus and the outside of the body. Vulvar cancer begins in the vulva, the outer part of the female genital organs. Each gynecologic cancer is unique, with different signs and symptoms, different risk factors, things that may increase your chance of getting a disease, and different prevention strategies. All women are at risk for gynecologic cancers, and risk increases with age. When gynecologic cancers are found early, treatment is most effective. What are the symptoms? View transcript audio description low resolution video. This video discusses the importance of knowing the signs and symptoms of gynecologic cancer. It is important to pay attention to your body and know what is normal for you, so you can recognize the warning signs or symptoms of gynecologic cancer, cervical, ovarian, uterine, vaginal, and vulvar cancers. If you have vaginal bleeding that is unusual for you, talk to a doctor right away. Any vaginal bleeding after menopause needs to be reported to your doctor. If you have not yet gone through menopause but notice that your periods are heavier, last longer than normal for you, or if you're having unusual bleeding between periods, talk to your doctor. You should also see a doctor if you have any other warning signs that last for 2 weeks or longer and are not normal for you. Symptoms may be caused by something other than cancer, but the only way to know is to see a doctor. Signs and symptoms are not the same for everyone, and each gynecologic cancer has its own signs and symptoms. Common symptoms of gynecologic cancers. Abnormal vaginal bleeding or discharge is common on all gynecologic cancers except vulvar cancer. Feeling full too quickly or difficulty eating, bloating, and abdominal or back pain are common for ovarian cancer. Pelvic pain or pressure is common for ovarian and uterine cancers. More frequent or urgent need to urinate and/or constipation are common for ovarian and vaginal cancers. Itching, burning, pain, or tenderness of the vulva, and changes in vulva color or skin, such as a rash, sores, or warts, are found only in vulvar cancer. What can I do to reduce my risk? Photo of a woman drinking coffee. It is important to recognize the warning signs of gynecologic cancer and learn if there are things you can do to lower your risk. Each type of gynecologic cancer, cervical, ovarian, uterine, vaginal, and vulvar cancers, has different risk factors, and risk increases with age. HPV vaccine. Cervical, vaginal, and vulvar cancers are caused by the human papillomavirus, HPV, a very common sexually transmitted infection. The HPV vaccine protects against the types of HPV that most often cause cervical, vaginal, and vulvar cancers. HPV vaccination is recommended for preteens aged 11 to 12 years, but can be given starting at age 9. HPV vaccine also is recommended for everyone through age 26 years, if they are not vaccinated already. HPV vaccination is not recommended for everyone older than age 26 years. However, some adults aged 27 through 45 years who are not already vaccinated may decide to get the HPV vaccine after speaking with their doctor about their risk for new HPV infections and the possible benefits of vaccination. HPV vaccination in this age range provides less benefit, as more people have already been exposed to HPV. If vaccination is started before age 15, a 2-dose schedule is recommended, with the doses given 6 to 12 months apart. For people who start the series after their 15th birthday, the vaccine is given in a series of 3 shots. HPV vaccination prevents new HPV infections, but does not treat existing infections or diseases. This is why the HPV vaccine works best when given before any exposure to HPV. You should get screened for cervical cancer regularly, even if you received an HPV vaccine. Screening tests. Screening is when a test is used to look for a disease before there are any symptoms. Cancer screening tests are effective when they can find disease early, which can lead to more effective treatment. Diagnostic tests are used when a person has symptoms. The purpose of diagnostic tests is to find out, or diagnose, what is causing the symptoms. Of all the gynecologic cancers, only cervical cancer has screening tests that can find this cancer early, when treatment works best. The Pap test also helps prevent cervical cancer by finding precancers, cell changes on the cervix that might become cervical cancer if they are not treated appropriately. A test called the HPV test looks for HPV infection. It can be used for screening women aged 30 years and older. Recognize the warning signs. Since there is no simple and reliable way to screen for any gynecologic cancers except cervical cancer, it is especially important to recognize warning signs and learn if there are things you can do to reduce your risk. Talk with your doctor if you believe you are at increased risk. Learn your family's health history of breast or ovarian cancer. Your doctor may recommend genetic counseling and testing. It is useful for a small percentage of women who have a family history of these cancers. It is not recommended for all women, but it is important for all women to know and tell their doctors about their family history. Talk with your doctor if you believe that you are at increased risk for gynecologic cancer. Ask what you might do to lower your risk and whether there are tests that you should have. How are gynecologic cancers treated? Photo of 2 women getting chemotherapy. Gynecologic cancer may be treated with chemotherapy. If your doctor says that you have a gynecologic cancer, ask to be referred to a gynecologic oncologist, a doctor who has been trained to treat cancers of a woman's reproductive system. This doctor will work with you to create a treatment plan. Types of treatment. Gynecologic cancers are treated in several ways. It depends on the kind of cancer and how far it has spread. Treatments may include surgery, chemotherapy, and radiation. Women with a gynecologic cancer often get more than one kind of treatment. Surgery, doctors remove cancer tissue in an operation. Chemotherapy, using special medicines to shrink or kill the cancer. The drugs can be pills you take or medicines given in your veins, or sometimes both. Radiation, using high-energy rays, similar to X-rays, to kill the cancer. Different treatments may be provided by different doctors on your medical team. Gynecologic oncologists are doctors who are trained to treat cancers of a woman's reproductive system. Surgeons are doctors who perform operations. Medical oncologists are doctors who treat cancer with medicine. Radiation oncologists are doctors who treat cancer with radiation. Clinical trials. Clinical trials use new treatment options to see if they are safe and effective. If you have cancer, you may want to take part. Visit the sites listed below for more information. NIH Clinical Research Trials and National Institutes of Health. Learn about clinical trials, National Cancer Institute. Search for clinical trials, National Cancer Institute. clinicaltrials.gov, National Institutes of Health. Complementary and alternative medicine. Complementary and alternative medicine are medicines and health practices that are not standard cancer treatments. Complementary medicine is used in addition to standard treatments, and alternative medicine is used instead of standard treatments. Meditation, yoga, and supplements like vitamins and herbs are some examples. Many kinds of complementary and alternative medicine have not been tested scientifically and may not be safe. Talk to your doctor about the risks and benefits before you start any kind of complementary or alternative medicine. Which treatment is right for me? Choosing the treatment that is right for you may be hard. Talk to your cancer doctor about the treatment options available for your type and stage of cancer. Your doctor can explain the risks and benefits of each treatment and their side effects. Side effects are how your body reacts to drugs or other treatments. Sometimes people get an opinion from more than one cancer doctor. This is called a second opinion. Getting a second opinion may help you choose the treatment that is right for you. Heavy menstrual bleeding. Menorrhagia is menstrual bleeding that lasts more than 7 days. It can also be bleeding that is very heavy. How do you know if you have heavy bleeding? If you need to change your tampon or pad after less than 2 hours or you pass clots the size of a quarter or larger, that is heavy bleeding. If you have this type of bleeding, you should see a doctor. Untreated heavy or prolonged bleeding can stop you from living your life to the fullest. It also can cause anemia. Anemia is a common blood problem that can leave you feeling tired or weak. If you have a bleeding problem, it could lead to other health problems. Sometimes treatments, such as dilation and curettage, DNC, or a hysterectomy, might be done when these procedures could have been avoided. Causes. Possible causes fall into the following 3 areas. Uterine-related problems. Growths or tumors of the uterus that are not cancer, these can be called uterine fibroids or polyps. Cancer of the uterus or cervix. Certain types of birth control, for example, an intrauterine device, IUD. Problems related to pregnancy, such as a miscarriage or ectopic pregnancy, can cause abnormal bleeding. A miscarriage is when an unborn baby, also called a fetus, dies in the uterus. An ectopic pregnancy is when a baby starts to grow outside the womb, uterus, which is not safe. Hormone-related problems. Other illnesses or disorders. Bleeding-related disorders, such as von Willebrand disease, VWD, or platelet function disorder. Non-bleeding-related disorders such as liver, kidney, or thyroid disease, pelvic inflammatory disease, and cancer. In addition, certain drugs, such as aspirin, can cause increased bleeding. Doctors have not been able to find the cause in half of all women who have this problem. If you have bleeding such as this, and your gynecologist has not found any problems during your routine visit, you should be tested for a bleeding disorder. Menstrual chart thumbnail. View and print this chart, PDF, 675 kilobytes. Signs. You might have menorrhagia if you have a menstrual flow that soaks through one or more pads or tampons every hour for several hours in a row. Need to double up on pads to control your menstrual flow. Need to change pads or tampons during the night. Have menstrual periods lasting more than 7 days. Have a menstrual flow with blood clots the size of a quarter or larger. Have a heavy menstrual flow that keeps you from doing the things you would do normally. Have constant pain in the lower part of the stomach during your periods. Are tired, lack energy, or are short of breath. Diagnosis. Finding out if a woman has heavy menstrual bleeding often is not easy because each person might think of heavy bleeding in a different way. Usually, menstrual bleeding lasts about 4 to 5 days and the amount of blood lost is small, 2 to 3 tablespoons. However, women who have menorrhagia usually bleed for more than 7 days and lose twice as much blood. If you have bleeding that lasts longer than 7 days per period, or is so heavy that you have to change your pad or tampon nearly every hour, you need to talk with your doctor. To find out if you have menorrhagia, your doctor will ask you about your medical history and menstrual cycles. He or she may ask you questions like the following. How old were you when you got your first period? How long is your menstrual cycle? How many days does your period usually last? How many days do you consider your period to be heavy? How do your periods affect your quality of life? Your doctor may also ask if any of your family members have had heavy menstrual bleeding. He or she may also have you complete this questionnaire, PDF, 127 kilobytes, to help determine if you need to be tested for a possible bleeding disorder. You might want to track your periods by writing down the dates of your periods and how heavy you think your flow is, maybe by counting how many pads or tampons you use. Do this before you visit the doctor so that you can give the doctor as much information as possible. Above is a picture of a chart that is used by some doctors to track your period. You can make your own chart based on the one shown. Your doctor also will do a pelvic exam and might tell you about other tests that can be done to help find out if you have menorrhagia. Tests. Your doctor might tell you that one or more of the following tests will help find out if you have a bleeding problem. Blood test. In this test, your blood will be taken using a needle. It will then be looked at to check for anemia, problems with the thyroid, or problems with the way the blood clots. Pap test. For this test, cells from your cervix are removed and then looked at to find out if you have an infection, inflammation, or changes in your cells that might be cancer or might cause cancer. Endometrial biopsy. Tissue samples are taken from the inside lining of your uterus or endometrium to find out if you have cancer or other abnormal cells. You might feel as if you were having a bad menstrual cramp while this test is being done. But it does not take long, and the pain usually goes away when the test ends. Ultrasound. This is a painless test using sound waves and a computer to show what your blood vessels, tissues, and organs look like. Your doctor then can see how they are working and check your blood flow. Using the results of these first tests, the doctor might recommend more tests, including sonohysterogram. This ultrasound scan is done after fluid is injected through a tube into the uterus by way of your vagina and cervix. This lets your doctor look for problems in the lining of your uterus. Mild to moderate cramping or pressure can be felt during this procedure. Hysteroscopy. This is a procedure to look at the inside of the uterus using a tiny tool to see if you have fibroids, polyps, or other problems that might be causing bleeding. You might be given drugs to put you to sleep. This is known as general anesthesia, or drugs simply to numb the area being looked at. This is called local anesthesia. Dilation and curettage, DNC. This is a procedure, or test, that can be used to find and treat the cause of bleeding. During a DNC, the inside lining of your uterus is scraped and looked at to see what might be causing the bleeding. A DNC is a simple procedure. Most often it is done in an operating room, but you will not have to stay in the hospital afterwards. You might be given drugs to make you sleep during the procedure, or you might be given something that will numb only the area to be worked on. Treatment. The type of treatment you get will depend on the cause of your bleeding and how serious it is. Your doctor also will look at things such as your age, general health, and medical history, how well you respond to certain medicines, procedures, or therapies, and your wants and needs. For example, some women do not want to have a period, some want to know when they can usually expect to have their period, and some want just to reduce the amount of bleeding. Some women want to make sure they can still have children in the future. Others want to lessen the pain more than they want to reduce the amount of bleeding. Some treatments are ongoing and others are done one time. You should discuss all of your options with your doctor to decide which is best for you. Following is a list of the more common treatments. Drug therapy. Iron supplements. To get more iron into your blood to help it carry oxygen if you show signs of anemia. Ibuprofen, Advil. To help reduce pain, menstrual cramps, and the amount of bleeding. In some women, NSAIDs can increase the risk of bleeding. Birth control pills. To help make periods more regular and reduce the amount of bleeding. Intrauterine contraception, IUC. To help make periods more regular and reduce the amount of bleeding through drug-releasing devices placed into the uterus. Hormone therapy, drugs that contain estrogen and/or progesterone. To reduce the amount of bleeding. Desmopressin nasal spray, Stymate. To stop bleeding in people who have certain bleeding disorders, such as von Willebrand disease and mild hemophilia, by releasing a clotting protein or factor, stored in the lining of the blood vessels that helps the blood to clot and temporarily increasing the level of these proteins in the blood. Antifibrinolytic medicines, tranexamic acid, aminocaproic acid. To reduce the amount of bleeding by stopping a clot from breaking down once it has formed. Surgical treatment. Dilation and curettage, DNC. A procedure in which the top layer of the uterus lining is removed to reduce menstrual bleeding. This procedure might need to be repeated over time. Operative hysteroscopy. A surgical procedure, using a special tool to view the inside of the uterus, that can be used to help remove polyps and fibroids, correct abnormalities of the uterus, and remove the lining of the uterus to manage heavy menstrual flow. Endometrial ablation or resection. Two types of surgical procedures using different techniques in which all or part of the lining of the uterus is removed to control menstrual bleeding. While some patients will stop having menstrual periods altogether, others may continue to have periods, but the menstrual flow will be lighter than before. Although the procedures do not remove the uterus, they will prevent women from having children in the future. Hysterectomy. A major operation requiring hospitalization that involves surgically removing the entire uterus. After having this procedure, a woman can no longer become pregnant and will stop having her period. Menorrhagia is common among women. But many women do not know that they can get help for it. Others do not get help because they are too embarrassed to talk with a doctor about their problem. Talking openly with your doctor is very important in making sure you are diagnosed properly and get the right treatment. Who is affected? Heavy bleeding, menorrhagia, is one of the most common problems women report to their doctors. It affects more than 10 million American women each year. This means that about 1 out of every 5 women has it. Infertility means not being able to get pregnant after at least 1 year of trying, or 6 months if the woman is over age 35. If a woman keeps having miscarriages, it is also called infertility. Female infertility can result from age, physical problems, hormone problems, and lifestyle or environmental factors. Most cases of infertility in women result from problems with producing eggs. In primary ovarian insufficiency, the ovaries stop functioning before natural menopause. In polycystic ovary syndrome, PCOS, the ovaries may not release an egg regularly, or they may not release a healthy egg. About a third of the time, infertility is because of a problem with the woman. 1/3 of the time, it is a problem with the man. Sometimes, no cause can be found. If you think you might be infertile, see your doctor. There are tests that may tell if you have fertility problems. When it is possible to find the cause, treatments may include medicines, surgery, or assisted reproductive technologies. Happily, many couples treated for infertility are able to have babies. Department of Health and Human Services Office on Women's Health. What is an anti-Müllerian hormone, AMH, test? An anti-Müllerian hormone, AMH, test measures the amount of AMH in a blood sample. In males, AMH is made by the testicles, or testes, which are glands that make sperm and male hormones. In females, the ovaries make AMH. The ovaries are glands where eggs form and female hormones are made. AMH plays different roles in males and females, and normal levels of AMH vary with your sex and your age. Measuring AMH levels can provide information about a variety of reproductive health conditions. In unborn babies, AMH helps form the male and female reproductive organs. The sex of unborn babies is set by the chromosomes they inherit from their parents. Male babies have XY chromosomes and female babies have XX chromosomes. But the development of their reproductive organs and genitals is affected by hormones, including AMH. In the early weeks of pregnancy, both male and female babies have a set of ducts, tubes, called Müllerian ducts. Normally, male babies make high levels of AMH in their testicular tissue. The AMH makes the Müllerian ducts shrink and helps male organs to grow. AMH levels stay high in male children until puberty, when they begin to decrease. Unborn female babies have very low levels of AMH. This allows the Müllerian ducts to develop into the uterus, fallopian tubes, and the upper part of the vagina. AMH stays low in female children. At puberty, follicles inside the ovaries begin to make more AMH. Follicles are small sacs in the ovaries that hold immature eggs. In healthy females of childbearing age, higher levels of AMH mean that the ovaries have a larger supply of eggs. As females age, the number of eggs decreases, which causes AMH levels to decrease. At menopause, no eggs are left, and AMH levels drop to zero. Other names: AMH hormone test, Müllerian inhibiting hormone, MIH, Müllerian inhibiting factor, MIF, Müllerian inhibiting substance, MIS. What is it used for? AMH tests are mainly used with other tests to make decisions about treating female infertility, not being able to get pregnant. If you're having infertility treatment, AMH testing can check how many eggs you have left in your ovaries. This is called your ovarian reserve. It's normal for your ovarian reserve to decrease with age. An AMH test can tell you the size of your ovarian reserve, but it can't tell you about the health of your eggs or predict whether you'll be able to get pregnant. Predict how well you may respond to fertility medicine. Normally, your ovaries prepare one egg for fertilization each month. If you're using in vitro fertilization, IVF, to have a baby, your healthcare provider will prescribe fertility medicine to make your ovaries prepare many eggs at the same time. The eggs are removed and mixed with sperm to make embryos outside of your body. Then the embryos are either frozen or put into the uterus to start a pregnancy. Testing your AMH level helps your provider know what dose of fertility medicine you may need to get the best response. Diagnostic testing for female infertility. An evaluation of a woman for infertility is appropriate for women who have not become pregnant after having 12 months of regular, unprotected intercourse. Being evaluated earlier is appropriate after 6 months for women who are older than age 35 or who have one of the following in their medical history or physical examination. History of irregular menstrual cycles, over 35 days apart or no periods at all. Known or suspected problems with the uterus, womb, tubes, or other problems in the abdominal cavity, like endometriosis or adhesions. Known or suspected male infertility problems. Any evaluation for infertility should be done in a focused and cost-effective way to find all relevant factors, and should include the male as well as female partners. The least invasive methods that can detect the most common causes of infertility should be done first. The speed and extent of evaluation should take into account the couple's preferences, the woman's age, the duration of infertility, and unique features of the medical history and physical examination. The following tests may be recommended as part of your infertility evaluation. Male partner semen analysis. Although the semen analysis is obtained from the male partner, it is an essential part of the infertility evaluation. A semen analysis should provide information about the number, movement, and shape of the sperm. A semen analysis is necessary even if the male partner has fathered a child before. Hysterosalpingogram, HSG. This is an X-ray procedure to see if the fallopian tubes are open and to if the shape of the uterine cavity is normal. A catheter is inserted into the opening of the cervix through the vagina. A liquid containing iodine, contrast, is injected through the catheter. The contrast fills the uterus and enters the tubes, outlining the length of the tubes, and spills out their ends if they are open. Transvaginal ultrasonography, an ultrasound probe placed in the vagina, allows the clinician to check the uterus and ovaries for abnormalities such as fibroids and ovarian cysts. Ovarian reserve testing. When attempting to test for a woman's ovarian reserve, the clinician is trying to predict whether she can produce an egg or eggs of good quality and how well her ovaries are responding to the hormonal signals from her brain. The most common test to evaluate ovarian reserve is a blood test for follicle-stimulating hormone, FSH, drawn on cycle day 3. In addition to the FSH level, your physician may recommend other blood tests, such as estradiol, anti-Müllerian hormone, AMH, and/or inhibin B, as well as a transvaginal ultrasound to do an antral follicle count, the number of follicles or egg sacs seen during the early part of a menstrual cycle. Ovarian reserve testing is more important for women who have a higher risk of reduced ovarian reserve, such as women who are over age 35 years, have a family history of early menopause, have a single ovary, have a history of previous ovarian surgery, chemotherapy, or pelvic radiation therapy, have unexplained infertility, or have shown poor response to gonadotropin ovarian stimulation. Other blood tests, thyroid-stimulating hormone, TSH, and prolactin levels are useful to identify thyroid disorders and hyperprolactinemia, which may cause problems with fertility, menstrual irregularities, and repeated miscarriages. In women who are thought to have an increase in hirsutism, including hair on the face and/or down the middle of the chest or abdomen, blood tests for dehydroepiandrosterone sulfate, DHEAS, 17-alpha-hydroxyprogesterone, and total testosterone should be considered. A blood progesterone level, drawn in the second half of the menstrual cycle, can help document whether ovulation has occurred. Urinary luteinizing hormone, LH over-the-counter ovulation predictor kits detect the presence of LH in urine and can detect a rise in this hormone that occurs 1 to 2 days before ovulation. In contrast to blood progesterone levels, urinary LH tests can predict ovulation before it occurs. Urinary LH testing helps define the times of greatest fertility, the day of the LH surge and the following 2 days. However, these tests can be expensive and should only be used by women with menstrual cycles that are consistently 25 to 35 days in length. Sonohysterography. This procedure uses transvaginal ultrasound after filling the uterus with saline, a salt solution. This improves detection of intrauterine problems such as endometrial polyps and fibroids compared with using transvaginal ultrasonography alone. If an abnormality is seen, a hysteroscopy is typically done. This test is often done in place of HSG. Hysteroscopy. This is a surgical procedure in which a lighted telescope-like instrument, hysteroscope, is passed through the cervix to view the inside of the uterus. Hysteroscopy can help diagnose and treat abnormalities inside the uterine cavity, such as polyps, fibroids, and adhesions, scar tissue. Laparoscopy. This is a surgical procedure in which a lighted telescope-like instrument, laparoscope, is inserted through the wall of the abdomen into the pelvic cavity. Laparoscopy is useful to evaluate the pelvic cavity for endometriosis, pelvic adhesions, and other abnormalities. Laparoscopy is not a first-line option in the evaluation of a female patient. Because of its higher costs and potential surgical risk, it may be recommended depending on the results of other testing and a woman's history, such as pelvic pain and previous surgeries. For best results, the infertility evaluation should be individualized based on each woman's specific circumstances. What is an estrogen test? An estrogen test measures the level of estrogens usually in a sample of your blood, but sometimes in urine, pee. Estrogens are a group of hormones that play a key role in female reproductive health, including puberty, menstruation, pregnancy, and menopause. Estrogens are also important for heart, bone, and brain health in males and females. But males need estrogen in much smaller amounts. There are many types of estrogen, but only 3 types are commonly tested. Estrone, also called E1, is the only estrogen that females continue to make after menopause. Menopause is the time after menstrual periods have stopped for a year. Males and females make estrone in the adrenal glands that sit on top of each kidney, and in body fat. In females, the ovaries, the glands that contain eggs, also make estrone. Estradiol, also called E2, is the main estrogen in non-pregnant females of childbearing age. It's mostly made in the ovaries and is important for fertility, the ability to get pregnant. It also helps support brain and bone health. Males make small amounts of this estrogen in the testicles, the glands that make sperm. Estriol, also called E3, is an estrogen that increases during pregnancy. The placenta, the organ that grows in the uterus to provide nutrients and oxygen to the unborn baby, makes estriol. Measuring estriol levels can help monitor the health of a pregnancy and the unborn baby. Males and non-pregnant females have very low levels of this estrogen. Estrogen levels in females normally change a lot throughout life. In males, estrogen levels change much less. But levels that stay too high or too low may be a sign of a health problem. Other names: estradiol test, estrone, E1, estradiol, E2, estriol, E3, estrogenic hormone test. What is it used for? In females, estradiol and/or estrone testing may be used to help diagnose conditions that may be caused by estrogen levels that are too high or too low, such as early or late puberty, menstrual problems or abnormal vaginal bleeding, infertility, problems getting pregnant. To help monitor infertility treatments: hormone replacement therapy for menopause, hormone treatment for certain cancers such as breast cancer. During pregnancy, an estriol hormone test may be used to help diagnose certain birth defects, monitor a high-risk pregnancy. In males, estradiol and/or estrone tests may be used to see whether too much estrogen is causing conditions such as late puberty, breast growth, gynecomastia, infertility, erectile dysfunction (ED), problems having an erection. Why do I need an estrogen test? If you are female, you may need estrogen testing if you have early or delayed puberty, are childbearing age and have abnormal periods or no periods at all, are having trouble getting pregnant, have a high-risk pregnancy, have symptoms of menopause, including hot flashes and/or night sweats, use hormone replacement therapy after menopause, have vaginal bleeding after menopause, have a tumor that may be making estrogen. If you're pregnant, you may have an estriol test between weeks 15 and 20 of your pregnancy. The test may be part of a group of prenatal tests called a triple screen test or a quad screening test. The test can check whether your baby has a high risk for a genetic birth defect such as Down syndrome. You may be more likely to have a baby with a birth defect if you have a family history of birth defects, are age 35 or older, have diabetes, have had a viral infection during pregnancy. If you are male, you may need estrogen testing if you have delayed puberty, enlarged breasts or other symptoms of too much estrogen, have a tumor that may be making estrogen. What happens during an estrogen test? If you are tested at your provider's office or a lab, you will provide a blood or urine sample. If you use an at-home test, the sample is usually saliva, spit. For a blood test, a healthcare professional will take a blood sample from a vein in your arm, using a small needle. After the needle is inserted, a small amount of blood will be collected into a test tube or vial. You may feel a little sting when the needle goes in or out. This usually takes less than 5 minutes. For a urine test, you'll need to collect all your urine during a 24-hour period. This is called a 24-hour urine sample test. You will be given a special container to collect your urine and instructions on how to collect and store your samples. Your provider will tell you what time to start. The test generally includes the following steps. To begin, urinate in the toilet as usual. Do not collect this urine. Write down the time you urinated. For the next 24 hours, collect all your urine in the container. During the collection period, store the urine container in a refrigerator or in a cooler with ice. 24 hours after starting the test, try to urinate if you can. This is the last urine collection for the test. Return the container with your urine to your provider's office or the laboratory as instructed. For an at-home saliva test, you'll collect a sample of saliva and send it to a lab for testing. Ask your provider which test is best to use. Be sure to follow all the instructions that come with your kit and discuss your results with your provider. Will I need to do anything to prepare for the test? You don't need any special preparations for an estrogen test. Are there any risks to the test? There is very little risk to having a blood test. You may have slight pain or bruising at the spot where the needle was put in, but most symptoms go away quickly. There is no known risk to a urine or saliva test. What do the results mean? Your test results will mean different things depending on your age, your sex, the reasons for having the test, the type of estrogen that was measured, the results of other tests you may have had. Talk with your provider to find out what your results mean for your health. Because estrogen levels often change, you may need to be tested more than once to look for a trend in your estrogen levels over time. Follicle-stimulating hormone, FSH, levels test. Email this page to a friend, print Facebook, Twitter, Pinterest. What is a follicle-stimulating hormone, FSH, levels test? This test measures the level of follicle-stimulating hormone, FSH, in your blood. FSH is made by your pituitary gland, a small gland located underneath the brain. FSH plays an important role in sexual development and functioning. In women, FSH helps control the menstrual cycle and stimulates the growth of eggs in the ovaries. FSH levels in women change throughout the menstrual cycle, with the highest levels happening just before an egg is released by the ovary. This is known as ovulation. In men, FSH helps control the production of sperm. Normally, FSH levels in men do not change very much. In children, FSH levels are usually low until puberty, when levels begin to rise. In girls, it helps signal the ovaries to make estrogen. In boys, it helps signal the testes to make testosterone. Too much or too little FSH can cause a variety of problems, including infertility, the inability to get pregnant, menstrual difficulties in women, low sex drive in men, and early or delayed puberty in children. Other names: phollotropin, FSH, follicle-stimulating hormone, serum. What is it used for? FSH works closely with another hormone called luteinizing hormone to control sexual functions. So a luteinizing hormone test is often done along with an FSH test. These tests are used in different ways, depending on whether you are a woman, man, or child. In women, these tests are most often used to help find the cause of infertility, find out if there is a problem with ovarian function, find the reason for irregular or stopped menstrual periods, confirm the start of menopause or perimenopause. Menopause is the time in a woman's life when her menstrual periods have stopped and she can't become pregnant anymore. It usually starts when a woman is around 50 years old. Perimenopause is the transition period before menopause. It can last for several years. FSH testing may be done towards the end of this transition. In men, these tests are most often used to help find the cause of infertility, find the reason for a low sperm count, find out if there is a problem with the testicles. In children, these tests are most often used to help diagnose early or delayed puberty. Puberty is considered early if it starts before age 9 in girls and before age 10 in boys. Puberty is considered delayed if it hasn't started by age 13 in girls and by age 14 in boys. Why do I need an FSH levels test? If you are a woman, you may need this test if you've been unable to get pregnant after 12 months of trying. Your menstrual cycle is irregular. Your periods have stopped. The test may be used to find out if you have gone through menopause or are in perimenopause. If you are a man, you may need this test if you've been unable to get your partner pregnant after 12 months of trying. Your sex drive is decreased. Both men and women may need testing if they have symptoms of a pituitary disorder. These include some of the symptoms listed above, as well as fatigue, weakness, weight loss, decreased appetite. Your child may need an FSH test if he or she does not seem to be starting puberty at the right age, either too early or too late. What happens during an FSH levels test? A healthcare professional will take a blood sample from a vein in your arm using a small needle. After the needle is inserted, a small amount of blood will be collected into a test tube or vial. You may feel a little sting when the needle goes in or out. This usually takes less than 5 minutes. Will I need to do anything to prepare for the test? If you are a woman who has not gone through menopause, your provider may want to schedule your test at a specific time during your menstrual cycle. Are there any risks to the test? There is very little risk to having a blood test. You may have slight pain or bruising at the spot where the needle was put in, but most symptoms go away quickly. What do the results mean? The meaning of your results will depend on whether you are a woman, man, or child. If you are a woman, high FSH levels may mean you have primary ovarian insufficiency, POI, also known as premature ovarian failure. POI is the loss of ovarian function before the age of 40. Polycystic ovary syndrome, PCOS, a common hormonal disorder affecting childbearing women. It is one of the leading causes of female infertility. Started menopause or are in perimenopause. An ovarian tumor. Turner syndrome, a genetic disorder that affects sexual development in females. It often causes infertility. If you are a woman, low FSH levels may mean your ovaries are not making enough eggs. Your pituitary gland is not working correctly. You have a problem with your hypothalamus, a part of the brain that controls the pituitary gland and other important body functions. You are very underweight. If you are a man, high FSH levels may mean your testicles have been damaged due to chemotherapy, radiation, infection, or alcohol abuse. You have Klinefelter syndrome, a genetic disorder affects sexual development in males. It often causes infertility. If you are a man, low FSH levels may mean you have a disorder of the pituitary gland or hypothalamus. In children, high FSH levels, along with high levels of luteinizing hormone, may mean puberty is about to start or has already started. If this is happening before age 9 in a girl or before age 10 in a boy, precocious puberty, it may be a sign of a disorder of the central nervous system, a brain injury. Low FSH and luteinizing hormone levels in children may be a sign of delayed puberty. Delayed puberty may be caused by A disorder of the ovaries or testicles. Turner syndrome in girls. Klinefelter syndrome in boys. An infection. A hormone deficiency. An eating disorder. If you have questions about your results or your child's results, talk to your healthcare provider. Learn more about laboratory tests, reference ranges, and understanding results. Is there anything else I need to know about an FSH levels test? There is an at-home test that measures FSH levels in urine. The kit is designed for women who want to find out if certain symptoms such as irregular periods, vaginal dryness, and hot flashes may be due to menopause or perimenopause. The test can show whether you have high FSH levels, a sign of menopause or perimenopause. But it doesn't diagnose either condition. After taking the test, you should talk with your healthcare provider about the results. What is a hysterosalpingogram, HSG? A hysterosalpingogram or HSG is an X-ray procedure used to see whether the fallopian tubes are patent, open, and if the inside of the uterus, uterine cavity, is normal. HSG is an outpatient procedure that usually takes less than 5 minutes to perform. It is usually done after the menstrual period ends, but before ovulation. How is a hysterosalpingogram done? A woman is positioned under a fluoroscope, an X-ray imager that can take pictures during the study, on a table. The gynecologist or radiologist then examines the patient's uterus and places a speculum in her vagina. Her cervix is cleaned, and a device, cannula, is placed into the opening of the cervix. The doctor gently fills the uterus with a liquid containing iodine, a fluid that can be seen by X-ray, through the cannula. The contrast will be seen as white on the image and can show the contour of the uterus as the liquid travels from the cannula, into the uterus, and through the fallopian tubes. As the contrast enters the tubes, it outlines the length of the tubes and spills out their ends if they are open. Abnormalities inside the uterine cavity may also be detected by the doctor observing the X-ray images when the fluid movement is disrupted by the abnormality. The HSG procedure is not designed to evaluate the ovaries or to diagnose endometriosis, nor can it identify fibroids that are outside of the endometrial cavity, either in the muscular part of the uterus or on the outside of the uterus. Often, side views of the uterus and tubes are obtained by having the woman change her position on the table. After the HSG, a woman can immediately return to normal activities, although some doctors ask that she refrain from intercourse for a few days. Is it uncomfortable? An HSG usually causes mild or moderate uterine cramping for about 5 to 10 minutes. However, some women may experience cramps for several hours. These symptoms can be greatly reduced by taking medications used for menstrual cramps before the procedure or when they occur. Women should be prepared to have a family member or friend drive them home after the procedure in the event that they are experiencing cramping. Does a hysterosalpingogram enhance fertility? It is controversial whether this procedure enhances fertility. Some studies show a slight increase in fertility lasting about 3 months after a normal HSG. However, most doctors perform HSG only for diagnostic reasons. What are the risks and complications of HSG? HSG is considered a very safe procedure. However, there is a set of recognized complications, some serious, which occur less than 1% of the time. Infection. The most common serious problem with HSG is pelvic infection. This usually occurs when a woman has had previous tubal disease, such as a past infection of chlamydia. In rare cases, infection can damage the fallopian tubes or make it necessary to remove them. A woman should call her doctor if she experiences increasing pain or a fever within 1 to 2 days of the HSG. Fainting. Rarely, the woman may get lightheaded during or shortly after the procedure. Radiation exposure. Radiation exposure from an HSG is very low, less than with a kidney or bowel study. This exposure has not been shown to cause harm, even if a woman conceives later the same month. The HSG should not be done if pregnancy is suspected. Iodine allergy. Rarely, a woman may have an allergy to the iodine contrast used in HSG. A woman should inform her doctor if she is allergic to iodine, intravenous contrast dyes, or seafood. Women who are allergic to iodine should have the HSG procedure performed without an iodine-containing contrast solution. If a woman experiences a rash, itching, or swelling after the procedure, she should contact her doctor. Spotting sometimes occurs for 1 to 2 days after HSG. Unless instructed otherwise, a woman should notify her doctor if she experiences heavy bleeding after HSG. What is the next step if my tubes are blocked? If your tubes are blocked, your doctor will likely recommend either a surgical procedure to directly view the tubes, laparoscopy, or to bypass the tubes and perform in vitro fertilization, IVF. This is a complex decision that should be discussed with your doctor. For more information, please see the ASRM booklet Laparoscopy and Hysteroscopy and Fact Sheet. What do I need to know about conceiving after tubal surgery? Are there other options to evaluate tubal patency? Laparoscopy can also determine if tubes are open, using a procedure called chromoperturbation. An alternative procedure to evaluate tubal patency is a sonohysterosalpingogram (SHG). For SHG, a catheter, narrow tube, is placed in the uterus through the vagina and saline and air are injected. In women who have open fallopian tubes, tiny air bubbles may be seen going through the fallopian tubes during the ultrasound. However, this procedure is inferior to HSG for assessment of tubal patency. Hysterosalpingography. Hysterosalpingography, HSG, evaluates the shape of the uterus and checks whether the fallopian tubes are open. It's also used to investigate miscarriages due to problems in the uterus. Tell your doctor if you are pregnant and discuss any recent illnesses, medical conditions, allergies, and medications you're taking. Do not have this procedure if you think you may be pregnant or have an active pelvic infection. Tell your doctor if you are allergic to iodinated contrast material. Tell your doctor if you have a pelvic infection or an untreated sexually transmitted disease, STD. Wear loose, comfortable clothing and leave jewelry at home. You will need to wear a gown, like getting a pelvic exam. What is hysterosalpingography? HSG is an X-ray exam of the uterus and fallopian tubes. It uses a special form of X-ray called fluoroscopy and a contrast material. An X-ray exam helps doctors diagnose and treat medical conditions. It exposes you to a small dose of ionizing radiation to produce pictures of the inside of the body. X-rays are the oldest and most often used form of medical imaging. Your doctor uses fluoroscopy to see your internal organs in motion. Your doctor will fill your uterus and fallopian tubes with a water-soluble contrast material. Your radiologist will then use fluoroscopy to view and assess them. Top of page. What are some common uses of the procedure? Doctors primarily use this exam to examine why you might be having difficulty becoming pregnant. The doctor looks at the openness of the fallopian tubes, the shape and structure of the uterus, and any scarring within the uterine or nearby peritoneal, abdominal, cavity. The exam also checks whether the fallopian tubes are open. The exam can also evaluate the effects of tubal surgery, procedure, or other conditions that lead to scarring. These effects include blockage of the fallopian tubes due to infection or scarring, tubal ligation, closure of the fallopian tubes in a sterilization procedure and a sterilization reversal, reopening of the fallopian tubes following a sterilization or disease-related blockage. The exam can investigate repeated miscarriages resulting from congenital or acquired uterine problems such as uterine fibroids, endometrial, uterine, polyps, adhesions, congenital problems, uterine anomalies, tumors. Top of page. How should I prepare? Schedule your exam for 7 to 10 days after the first day of your menstrual period, but before ovulation. This is the best time for the exam. Do not have this procedure if you have an active pelvic infection. Tell your doctor and technologist if you have any signs of pelvic infection, or an untreated STD. Tell your doctor if you are allergic to iodinated contrast. Before the procedure, you may take over-the-counter pain medication, acetaminophen, for example, to minimize any discomfort. Some doctors prescribe an antibiotic prior to and/or after the procedure. Tell your doctor about all the medications you take. List any allergies, especially to iodine contrast materials. Tell your doctor about recent illnesses or other medical conditions. You will need to remove some clothing and wear a gown for the exam. Remove any metal objects or clothing in the pelvis that might interfere with the X-ray images. Women should always tell their doctor and technologist if they are pregnant. Doctors will not perform many tests during pregnancy to avoid putting the fetus at risk. If an X-ray is necessary, the doctor will take precautions to minimize radiation exposure to the baby. See the radiation safety page for more information about pregnancy and X-rays. Top of page. What does the equipment look like? This exam typically uses a radiographic table, 1 or 2 X-ray tubes, and a video monitor. Fluoroscopy converts X-rays into video images. Doctors use it to watch and guide procedures. The X-ray machine and a detector suspended over the exam table produce the video. Top of page. How does the procedure work? X-rays are a form of radiation like light or radio waves. X-rays pass through most objects, including the body. The technologist carefully aims the X-ray beam at the area of interest. The machine produces a small burst of radiation that passes through your body. The radiation records an image on photographic film or a special detector. Fluoroscopy uses a continuous or pulsed X-ray beam to create images and project them onto a video monitor. Your exam may use a contrast material to clearly define the area of interest. Fluoroscopy allows your doctor to view joints or internal organs in motion. The exam also captures still images or movies and stores them electronically on a computer. Most X-ray images are electronically stored digital files. Your doctor can easily access these stored images to diagnose and manage your condition. Top of page. How is the procedure performed? Your doctor will likely do this exam on an outpatient basis. The procedure is like a gynecological exam. You will lie on your back on the exam table with your knees bent, or your feet will be held up with stirrups. Your doctor will insert a speculum into your vagina, clean the cervix, and insert a catheter. The doctor will remove the speculum and carefully position you underneath the fluoroscopy camera. The doctor will fill the uterine cavity, fallopian tubes, and peritoneal cavity with contrast material through the catheter and capture the fluoroscopic images. The doctor may ask you to shift position underneath the fluoroscopy camera. When the procedure is complete, the doctor will remove the catheter and allow you to sit up. When the examination is complete, the technologist may ask you to wait until the radiologist confirms they have all the necessary images. The exam usually takes about 30 minutes. Top of page. What will I experience during and after the procedure? This exam should cause only minor discomfort. You may have some slight discomfort and cramping when the doctor places the catheter and injects the contrast material. This should not last long. There may also be slight irritation of the peritoneum, the lining of the abdominal cavity. This may cause lower abdominal pain. This should be minimal and brief. Most women experience vaginal spotting for a few days after the exam. This is normal. Who interprets the results, and how do I get them? A radiologist, a doctor trained to supervise and interpret radiology examinations, will analyze the images. The radiologist will send a signed report to your primary care or referring physician who will discuss the results with you. You may need a follow-up exam. If so, your doctor will explain why. Sometimes a follow-up exam further evaluates a potential issue with more views or a special imaging technique. It may also see if there has been any change in an issue over time. Follow-up exams are often the best way to see if treatment is working or if a problem needs attention. Top of page. What are the benefits versus risks? Benefits. This exam is minimally invasive, complications are rare. It can offer valuable information on problems getting pregnant or carrying a fetus to term. It can potentially open blocked fallopian tubes to allow you to become pregnant in the future. No radiation stays in your body after an X-ray exam. X-rays usually have no side effects in the typical diagnostic range for this exam. Risks. There is always a slight chance of cancer from excessive exposure to radiation. However, given the small amount of radiation used in medical imaging, the benefit of an accurate diagnosis far outweighs the associated risk. The radiation dose for this procedure varies. See the radiation dose page for more information. Tell the doctor and technologist if you have a pelvic infection, inflammatory condition, or untreated STD. This will help you avoid making any such infection worse. Women should always tell their doctor and X-ray technologist if they are pregnant. See the radiation safety page for more information about pregnancy and X-rays. A word about minimizing radiation exposure. Doctors take special care during X-ray exams to use the lowest radiation dose possible while producing the best images for evaluation. National and international radiology protection organizations continually review and update the technique standards radiology professionals use. Modern X-ray systems minimize stray, scatter, radiation by using controlled X-ray beams and dose control methods. This ensures that the areas of your body not being imaged receive minimal radiation exposure. Top of page. What are the limitations of hysterosalpingography? This exam only sees the inside of the uterus and fallopian tubes. Your doctor may use MRI or ultrasound to look at problems in the ovaries, uterine wall, and other pelvic structures. This exam cannot evaluate infertility problems due to low or abnormal sperm count or the inability of a fertilized egg to implant in the uterus. Hysteroscopy. Email this page to a friend, print Facebook, Twitter, Pinterest. What is a hysteroscopy? A hysteroscopy is a procedure that allows a healthcare provider to look at the inside of a woman's cervix and uterus. It uses a thin tube called a hysteroscope, which is inserted through the vagina. The tube has a camera on it. The camera sends images of the uterus onto a video screen. The procedure can help diagnose and treat causes of abnormal bleeding, uterine diseases, and other conditions. Other names: hysteroscopic surgery, diagnostic hysteroscopy, operative hysteroscopy. What is it used for? A hysteroscopy is most often used to diagnose the cause of abnormal bleeding, help find the cause of infertility, the inability to get pregnant after at least a year of trying, find the cause of repeated miscarriages, more than 2 miscarriages in a row, find and remove fibroids and polyps. These are types of abnormal growths in the uterus. They are usually not cancerous. Remove scar tissue from the uterus. Remove an intrauterine device, IUD, a small, plastic device placed inside the uterus to prevent pregnancy. Perform a biopsy. A biopsy is a procedure that removes a small sample of tissue for testing. Implant a permanent birth control device into the fallopian tubes. Fallopian tubes carry eggs from the ovaries into the uterus during ovulation, the release of an egg during the menstrual cycle. Why do I need a hysteroscopy? You may need this test if you are having heavier than normal menstrual periods and/or bleeding between periods. You are bleeding after menopause. You are having trouble getting or staying pregnant. You want a permanent form of birth control. You want to remove an IUD. What happens during a hysteroscopy? A hysteroscopy is often done in a hospital or outpatient surgery center. The procedure usually includes the following steps. You will remove your clothing and put on a hospital gown. You will lie on your back on an exam table with your feet in stirrups. An intravenous, line may be put in your arm or hand. You may be given a sedative, a type of medicine, to help you relax and block the pain. Some women may be given general anesthesia. General anesthesia is a medicine that will make you unconscious during the procedure. A specially trained doctor, called an anesthesiologist, will give you this medicine. Your vaginal area will be cleaned with a special soap. Your provider will insert a tool, called a speculum, into your vagina. It is used to spread open your vaginal walls. Your provider will then insert the hysteroscope into the vagina and move it through your cervix and into your uterus. Your provider will inject a liquid or gas through the hysteroscope and into your uterus. This helps expand the uterus so your provider can get a better view. Your provider will be able to see images of the uterus on a video screen. Your provider may take a sample of tissue for testing, biopsy. If you are having a uterine growth removed or another uterine treatment, your provider will insert tools through the hysteroscope to perform the treatment. A hysteroscopy may take 15 minutes to an hour, depending on what was done during the procedure. The medicines you were given may make you drowsy for a while. You should arrange for someone to drive you home after the procedure. Will I need to do anything to prepare for the test? If you will be getting general anesthesia, you may need to fast, not eat or drink, for 6 to 12 hours before the procedure. Do not use a douche, tampons, or vaginal medicines for 24 hours before the test. It's best to schedule your hysteroscopy when you are not having your menstrual period. If you get your period unexpectedly, tell your healthcare provider. You may need to reschedule. Also, tell your provider if you are pregnant or think you might be. A hysteroscopy should not be done on pregnant women. The procedure may be harmful to an unborn baby. Are there any risks to the test? A hysteroscopy is a very safe procedure. You may have mild cramping and a little bloody discharge for a few days after the procedure. Serious complications are rare, but they may include heavy bleeding, infection, and tears in the uterus. What do the results mean? If your results were not normal, it may mean one of the following conditions. Fibroids, polyps, or other abnormal growths were found. Your provider may be able to remove these growths during the procedure. He or she may also take a sample of the growths for further testing. Scar tissue was found in the uterus. This tissue may be removed during the procedure. The size or shape of the uterus did not look normal. Openings on one or both fallopian tubes are closed. If you have questions about your results, talk to your healthcare provider. Is there anything else I need to know about a hysteroscopy? A hysteroscopy is not recommended for women with cervical cancer or pelvic inflammatory disease. Karyotype genetic test. Email this page to a friend, print Facebook, Twitter, Pinterest. What is a karyotype test? A karyotype test is a type of genetic testing. It looks at the size, shape, and number of chromosomes in a sample of cells from your body. Chromosomes are found in the cell nucleus, which is like the command center of a cell. Chromosomes contain your genes. Genes carry information, called DNA, that controls what you look like and how your body works. You inherit your chromosomes from your parents. Normally, all your cells, except for egg and sperm cells, have a set of the same 46 chromosomes. The chromosomes are grouped into 23 pairs. Each pair has 2 chromosomes, one coming from each parent. You may develop certain genetic disorders if your cells Are missing whole chromosomes or pieces of chromosomes. Have extra chromosomes or extra pieces of chromosomes. A karyotype test checks the chromosomes in your cells to see whether you have a full set of 46 chromosomes. Having too many or too few chromosomes can cause serious problems with health, growth, and normal development, such as Down syndrome, extra chromosome 21, and Turner syndrome, missing X chromosome. Look for changes in the structure of chromosomes, such as broken, missing, or extra parts. These changes may cause a wide variety of problems, depending on which chromosome is affected. But some changes in chromosomes don't cause problems. Certain chromosome problems are present from birth. Chromosome problems can also develop in certain cells after birth. These problems can cause specific types of cancer. Other names: genetic testing, chromosome studies, cytogenetic analysis. What is it used for? A karyotype test looks for unusual changes in chromosomes. It may be used to check you and/or your family members for specific chromosome problems if you have a genetic disorder that runs in your family. Have symptoms that may be from a genetic disorder. Check an unborn baby for chromosome problems. Find out if abnormal chromosomes are causing problems having children, including male or female infertility. Miscarriages, if you have lost 2 or more pregnancies before 20 weeks. Stillbirth. Help diagnose and/or make treatment decisions for certain types of cancer and blood disorders. Why do I need a karyotype test? You may need a karyotype test if you're planning to have children or are pregnant. To learn whether you and/or your partner have abnormal chromosomes that you could pass on to a baby. To find out why you're having problems getting pregnant or having miscarriages. To check your unborn baby for genetic disorders, especially if the baby has a high risk for problems. The risk may be high if the pregnant parent is age 35 or older. The overall risk of genetic birth defects is small, but the risk increases after age 35. Either parent has a genetic disorder, a family history of a genetic disorder, or another child with a genetic disorder. The results of certain prenatal screening tests weren't normal. You have a family history of a chromosomal disorder and want to know your risk for developing the disorder. You and/or your child have symptoms of a genetic disorder. Each type of genetic disorder has different symptoms. Karyotype testing may be needed to make a diagnosis. You've been diagnosed with certain cancers or blood disorders that often involve changes in chromosomes. These changes can affect how your disease will behave and which treatment will work best for you. Karyotype testing may be needed to help diagnose and treat conditions such as leukemia, lymphoma, multiple myeloma, anemia. What happens during a karyotype test? For a karyotype test, the type of sample you provide depends on the reason for the test. To test the chromosomes of an unborn baby, the sample may be gathered using amniocentesis. This procedure collects a sample of the amniotic fluid that surrounds the unborn baby during pregnancy. The fluid contains cells from the baby that can be tested. Amniocentesis is usually done between week 15 and 20 of pregnancy. Chorionic villus sampling, CVS. This procedure collects tissue from the chorionic villi, which are parts of the placenta that usually have the same chromosomes as the unborn baby. The placenta is the organ that grows in the uterus to provide nutrients and oxygen to the baby. A CVS is usually done between week 10 and 13 of pregnancy. To test the chromosomes of adults, children, and babies, the sample may be from a blood test. This is the most common sample used for karyotype tests. A healthcare professional will use a small needle to remove a blood sample from a vein in your arm. A buccal, cheek, swab. A healthcare professional will insert a swab into your mouth and rub it across the inside of your cheek to gather a sample of cells. A bone marrow test. This test may be used if you have a certain type of cancer or blood disorder. Marrow is soft, spongy tissue found inside of bones. Most bone marrow samples are taken from the back of the hip bone. Will I need to do anything to prepare for the test? For a CVS or amniocentesis, you may need to drink extra fluid and not urinate before your test so that your bladder is full. A blood test or cheek swab usually don't require any preparation. If you're having a bone marrow test, ask your provider for instructions about how to prepare. Are there any risks to the test? During amniocentesis or CVS, you may feel mild stinging or cramping. Both procedures are safe, but they do have a slight risk of causing miscarriage. Talk with your provider about the risks and benefits of these tests. A blood test has very little risk. You may have slight pain or bruising at the spot where the needle was put in, but most symptoms go away quickly. A cheek swab has no risk. After a bone marrow test, you may feel stiff or sore where the sample was taken. This usually goes away in a few days. Serious risks are rare. What do the results mean? A normal or negative result means that there were 46 chromosomes in the sample without any unusual changes in their structure. An abnormal or positive result means that unusual changes in the number or structure of chromosomes were found. Abnormal results can mean many things about your health or your child's health, depending on the chromosome changes that were found. Talk with your provider to learn what your results mean. Learn more about laboratory tests, reference ranges, and understanding results. Is there anything else I need to know about a karyotype test? If you're thinking about having a karyotype test or have received abnormal results, it may help to talk with a genetic counselor. Genetic counselors can give you information about how genetic conditions might affect you or your family. They can help you find support services and make informed decisions about treatment or management options for a genetic disorder.